Hello and welcome back to 3 News Now. I'm Stephanie Haney. It's Tuesday, October 6th. This is where we bring you the top stories from WKYC.com and our WKYC app. Thanks for choosing here to be with me this afternoon to get filled in on what's impacting you here in Northeast Ohio. We have breaking news just around 3 p.m. President Donald Trump has just tweeted that he has instructed Republican members of Congress to stop negotiating with Democratic leadership in the House of Representatives on an upcoming stimulus bill. President Donald Trump tweeted that House Speaker Nancy Pelosi is asking for that $2.4 trillion bailout package. He says that would be money going to poorly run, high-crime Democrat states and money that is in no way related to COVID-19. That's what the president has tweeted about it. Now, the president says that the Republicans have made a generous offer of $1.6 trillion and accuses Nancy Pelosi of not negotiating in good faith. So he says he is looking out for the future of the country and has instructed Republicans in Congress to stop negotiating on a stimulus bill and instead focus all efforts on the confirmation of his Supreme Court nominee, Judge Amy Coney Barrett. He then says that he will take up the issue after the election. President Donald Trump saying in that tweet that he will win the election. Of course, we will get those results on or hopefully shortly after November 3rd, depending on how things work out with the absentee ballots, which brings us to what's happening here in Northeast Ohio today. Today is the first day of early voting in Ohio, and people have been lining up. By noon today, nearly 800 people had cast in-person early ballots at the Cuyahoga County Board of Elections alone. Our Ohio Secretary of State Frank LaRose released a statement today that said over the past week, there have been almost 160,000 new absentee ballot requests submitted by Ohio voters. He said today, those absentee ballots went out in the mail to most voters, and about 2.2 million absentee ballot applications had been already received by the County Board of Elections. So more than 2 million absentee ballots being mailed out starting today here in Ohio. Now, at this time in 2016, the last presidential election, there had been about 1.1 million absentee ballots requested. Now, all of that data is current as of October 2nd. Ballots for absentee voters who are in the military and overseas, those began to be mailed out on September 18th. The rest of the absentee ballots started to be mailed out today. So let's take a recap of some deadlines you need to know about. If you have not yet requested an absentee ballot, you have to do that by October 31st, but the recommendation is you do that much sooner because you do need time for the post office to actually get you that ballot. And if you are mailing that ballot back in, that needs to be done by November 2nd, the day before the election. You can always drop it off on Election Day at your County Board of Elections. We will have updates, by the way, we have learned from the County Board of Elections on election night about how many outstanding absentee ballots still need to be received. So again, here in Ohio, remember, it has to be postmarked by November 2nd, but in order for your ballot to be counted, it can arrive at your County Board of Elections up to 10 days after the election. But the important part is that it is postmarked no later than November 2nd. So we will have updates again on those outstanding absentee ballots. That should help give people some idea of what delays are like if we do experience delays in election results just 4 weeks from today with that election coming up on November 3rd. Now, keep in mind that early voting hours in person at County Board of Elections will vary leading up until the election. We do have those listed on WKYC.com and the WKYC app. For now, for the next 10 days, that early voting will be Monday through Friday from 8 a.m. until 5 p.m. Now, going back to President Donald Trump and things that he has been tweeting today, there was a tweet today that got him in trouble with Twitter. He posted comments both on Facebook and on Twitter today comparing COVID-19 to the flu. Now, Facebook removed that post and Twitter flagged the post as violating their rules. This is the notice that Twitter posted on that tweet. This tweet violated the Twitter rules about spreading misleading and potentially harmful information related to COVID-19. However, Twitter has determined that it may be in the public's interest for the tweet to remain accessible. So they kept the tweet up, but they covered it up with that warning. And if you want to see that tweet, you can read that for yourself directly on the president's Real Donald Trump Twitter account. It's the tweet that you see with the Twitter flag on it there, again, comparing COVID-19 to the seasonal flu. Now, President Donald Trump's attitude has been alarming infectious disease experts, and it has been suggested that he is not taking it seriously enough, even though he has come down with COVID-19 and the First Lady has been infected, and more than a dozen White House aides and associates have been infected. An update on the president's health, the most up-to-date information we have, came in a letter today from the president's doctor, Navy Commander Dr. Sean Conley. And Dr. Conley said that Trump had a restful night at the White House and that today he reports no symptoms. Now, on Monday afternoon, shortly after President Donald Trump left Walter Reed National Medical Center, Dr. Conley said that the president would not be fully out of the woods for another week. So, assuming that those doctors are monitoring his health closely. Now, as we look to the first and the only vice presidential debate coming tomorrow, we do have reports to NBC News that the campaign for Senator Kamala Harris, who is the Democratic nominee for vice president, had asked for plexiglass barriers on the debate stage. Well, we're now learning that Vice President Mike Pence Chief of Staff Mark Short said on Tuesday that Mr. Pence is requesting no plexiglass divider be installed on his side of the stage during Wednesday's debate. The vice president's team says that the medical necessity of the shield is in question because of other safety measures, such as the 12-foot distance between the vice president and Senator Harris, along with their daily testing routine. However, it is important to note that doctors are reiterating over and over again right now that testing is a surveillance method. It is not a prevention method, whereas a plexiglass barrier, according to doctors, would be a prevention method for stopping potential exposure or spread of COVID-19, and testing is an after-the-fact method that is done in order to find out if you have already contracted COVID-19. It's not going to stop you from getting COVID-19. Now, for the plexiglass barriers to be used, it won't be the first time that this has happened. There was actually a plexiglass barrier used in the debate between Democratic Jamie Harrison and Republican Senator Lindsey Graham in South Carolina on Saturday during that debate. So the plexiglass barrier has already been approved by the Presidential Commission on Debates, and that is to happen tomorrow in Salt Lake City at the University of Utah at 9 p.m. Eastern. So time will tell what that setup will actually look like. We will have that on 3 News and on our social media platforms for you tomorrow live at 9 p.m. when Vice President Mike Pence and Democratic candidate for Vice President and Senator Kamala Harris do face off in that first and only debate. Now let's talk about the numbers here in Ohio related to COVID-19. In the last 24 hours, the Ohio Department of Health reports that the daily reported cases have gone up considerably. Deaths over the last 24 hours that have been reported are in the double digits, and new hospitalizations are way up here in Ohio. In the last 24 hours, there have been 1,335 new reported cases of COVID-19. That's up from yesterday when there were 1,057 new reported cases of COVID-19 and 941 reported cases on Sunday. Our positivity rate is at 3.2%. That's the same as it was on Monday. That's the 7-day average positivity rating. So over the last week for all the COVID-19 testing, that's been done, 3.2% of those are coming back positive. Now, in the last 24 hours, there have been 16 new reported deaths related to COVID-19 and 132 new hospitalizations. That's where we get into that real-time data when we look at the hospitalizations. That's almost double what we saw yesterday when there were 73 new hospitalizations. The total number of patients who are currently in the hospital is also up. That number is at 777 people right now hospitalized with COVID-19. And of those people, 207 of them are being treated in the intensive care unit. So about 27%, just a little over 1/4 of those people being treated in the ICU. We've seen 36 new ICU admissions in the last 24 hours. And in terms of the hospital beds, how many hospital beds are available, there are about 30% of our hospital beds available in the state for people who need inpatient treatment for whatever that might be. So 70% of our hospital beds are currently in use right now. Now let's take a look at the U.S. and the global numbers related to COVID-19. we take a look at this over the past couple of days, it is worth noting that more than 1,000 Americans died from COVID-19 while the president was in the hospital for those 3 nights at Walter Reed Medical Center. These numbers come from Johns Hopkins University. The total number of cases related to COVID-19 in the U.S. is now at almost 7.5 million. That number is 7,477,946. The total number of deaths is over 210,000. That number is 210,487. And here in the U.S., we have less than 5% of the global population, but we do have 20% of the known COVID-19 deaths and 21% of the known COVID-19 cases across the globe. That total number globally for cases is 35,622,409, and the total number of deaths globally is now 1,046,153. Now, at Kent State University, there are dozens of students who are quarantining following possible exposure to COVID-19. So now, Kent State is increasing its free COVID-19 testing. This is through a new partnership with CVS, and they'll be randomly selecting students to participate each week in the testing. CVS also plans to be on Kent's campus on weekdays to provide sample testing through November 20th. So the pharmacy will be using rapid tests. That means that each person will know their COVID-19 test results within 15 minutes. But do keep in mind, the medical experts have told us with that speed, there is the sacrifice of accuracy. There is definitely a greater percentage of both a false positive and a false negative. Now, for those who are not selected for the sample screening at Kent State, COVID-19 tests are also available on campus at the DeWeese Health Center. Now, looking forward to the weekend, the Cleveland Browns will be hosting their Crucial Catch Intercept Cancer Awareness game on Sunday against the Indianapolis Colts here at First Energy Stadium. Once again this year, the NFL, the Browns, and the American Cancer Society are looking at multiple types of cancer through the Crucial Catch campaign. This is in addition to breast cancer. And this is very important right now, particularly because something we have seen related to COVID-19 is that screenings for other health issues have actually dropped. And screenings for some types of cancers since March have dropped as much as 94%. So that many less people are getting these screenings for cancer. So very important that we're bringing awareness to this issue right now. So this will be the first of 2 cancer awareness games with the Browns. This will be on Sunday against the Indianapolis Colts. This is in partnership with University Hospital's Seidman Cancer Center. At the game, the Browns will honor both cancer survivors, people who are currently being treated for cancer, and the loved ones who have been impacted by cancer impacting the people in their lives. This is all part, again, of that Crucial Catch Intercept Cancer campaign. If you're interested in contributing, you can check out WKYC.com. We have all the links that are available there. There are certain things happening like an NFL auction with game-worn specific items and other ways that you can get involved as well with the NFL shop if you would like. Now, here's one note that we're going to end on for you today. There is a new study out about Halloween candy as we are in October and everybody's all excited about the spooky season. This is a study from the National Confectioners Association that was put together by the Morning Consult, which is a market research company. They say, shocking no one, that 79% of parents take candy from their children's Halloween stash. Now, the question is it really stealing? I guess it depends on who you ask. If I'm the kid, I'm saying yes, it's stealing. If I'm the parent, I'm saying no. Brought you into this world. I could take your candy out of it. Some of the other fun things that are in this study are that 31% of moms and dads say that they plan to hide away their favorite candy for Halloween, cherry picking the good stuff out of the bag. I happen to particularly like the peanut butter cups. I particularly like the peanut butter eggs. I know that's not something that you're getting at Halloween, but it has a little bit more peanut butter in it, so that's why I feel that way. And there are a lot of people in this study who are hoping to have a somewhat traditional Halloween, by the way. The majority of people in this study said they're hoping to celebrate it somewhat traditionally, and we will see what that happens. Of course, across Northeast Ohio, we know that some communities have canceled Halloween trick-or-treating. Some communities have said we're not going to have anything official, but neighborhoods can decide on their own, and some are moving forward and telling people if they don't want to participate, don't turn your light on, and don't send your children out. But of course, the medical experts are saying if you do send your children out trick-or-treating, They are recommending that you wear a mask and not rely on a costume mask, but an actual mask underneath that costume mask if there's one included in your child's costume. Lots of things to think about, but the takeaway here is that the parents are taking the candy. And it looks like candy sales are up, by the way. So the candy companies seem to be doing okay right now. And who can blame them? Who doesn't want a little bit of candy right now? That's it for your 3 News Now afternoon update. I will see you next on What's New at 5 p.m., which you can watch for free in the WKYC app. Just open up the app and click on watch, and then you'll see that live broadcast there. I'll have your trending stories in the Clicking in Cleveland segment, and then I'll be back here tomorrow with your 3 News Now update. In the meantime, go ahead and subscribe if you haven't already to the 3 News Now with Stephanie Haney podcast on your favorite podcast platform. And also, please rate and review the show if you are so inclined. We would really appreciate it. It really helps us connect with more of you here in Northeast Ohio and bring you the stories that are impacting you. That's it for me, everyone. Enjoy your afternoon. Stay safe and be well. I'll see you back here tomorrow. I'm Stephanie Haney.